I think the statistics say around 70% of cancer-related deaths occur in low and middle income countries. And we have a saying, where you live shouldn't determine if you live. So that really motivates me in terms of starting my career in global health and contributing to that field.
Hello everyone, my name is Kevin Bambury and I welcome you to another episode of Oncology Spotlight. Thank you for tuning in. I'm joined today by my co-host Ono Carl.
Hello everyone.
Our guest for this episode is Katy Winckworth-Prejsnar, who is the Director of the Global Program at the National Comprehensive Cancer Network, NCCN. Thanks very much for joining us, Katy. To kick things off, could you briefly give an overview of your background and yourself?
Yeah, and thank you so much for having me, Kevin and Owen. It's really an honor, and I'm actually quite excited. So as you mentioned, I'm Katy Winckworth-Prejsnar. I'm the Director of the Global Program at the National Comprehensive Cancer Network, NCCN. My background is in international relations, policy, and global health. I got my master's in public health and PH with a focus on global health at Drexel University. And right now at NCCN, I really focus on ensuring people worldwide have access to high quality, evidence-based standards in cancer care.
Excellent.
Super. And what inspired you to pursue a career in global health in oncology?
So I'll start with oncology. And, unfortunately, I think we've all been impacted by cancer, whether that be personally or with family or friends.
Yeah.
And for me, it was my mom. So she was diagnosed with melanoma skin cancer when she was pregnant with me. And unfortunately, after 5 years of intensive treatment, she passed away from the disease. But what got me really interested in oncology is seeing the advances and the innovation since then. And someone with melanoma diagnosed in 2025 has so many more options than my mom had access to. So it really inspired me, and I'm really grateful to contribute to the oncology community. So then why global health? If we use that same example, so if someone's diagnosed with melanoma in the US, they might have access to treatments, but in many parts of the world, they might not have that same access. We know there's huge disparities between access and outcomes for cancer between high resource countries and low resource countries. I think the statistics say around 70% of cancer-related deaths occur in low and middle income countries. And we have a saying, where you live shouldn't determine if you live. So that really motivates me in terms of starting my career in global health and contributing to that field. I'm also a big believer that there's so much knowledge to be gained crossing borders and learning from each other. And it really allows for a deeper understanding, not only of the global context, but how you can apply that to your local context. So these are kind of the areas that motivate me in the global oncology space.
Super.
Excellent. Could you tell us a bit about your role in the NCCN at present?
Yeah, and just in case some of your listeners are not as familiar with NCCN, we are a global nonprofit organization of 33 member institutions. These are large academic comprehensive cancer centers in the US, and our mission is to define and advance quality, effective, accessible cancer care and prevention. And while we have a number of great programs and great resources, I think what we're most known for is the development of NCCN clinical practice guidelines in oncology. We currently have a library of 88 different guidelines. These cover about 95% of all incidences of cancer worldwide, and they are represented in an algorithmic approach. And so it really helps clinicians and other practitioners follow the treatment pathway for their patients. They cover the continuum of care, so all the way from screening to survivorship. So why are guidelines important? So we know a large body of literature looks at the importance of guidelines in practice, and this is not just NCCN Guidelines. A number of great organizations create guidelines, ASCO, ESMO, national guidelines. And the research shows that first, guidelines standardize care. So you avoid undertreatment, you avoid overtreatment, and you really ensure patients are getting the latest and brightest access to evidence-based standards. They also help oncologists and practitioners really guide the care for their patients depending on the stage and the type of cancer. A large body of research looks at outcomes. So following guidelines, concordance to guidelines improves a number of different health outcomes, overall survival, less toxicities, quality of life, things like that. And I think the final point is that they help inform policy and reimbursement. So for example, in the US, NCCN guidelines are used for coverage determination in both our public and private setting. So that's an overview of guidelines and NCCN, but my role is kind of the global program. So just to give you some background, and it helps explain why we have a global program. We have about 2 million registered users to our website. Half of those users, 1 million, are located outside the US. And we had about 16 million guidelines that were downloaded last year. 8 million, or half of those, went outside the US. So as an organization, it's really important that we make sure that practitioners and oncologists all over the world can access our content. But we also think about ways we can make the guidelines more relevant for local contexts. So while a large majority of recommendations in our guidelines can be applied universally throughout the world, we understand that there are differences based on the local context, the local healthcare system, and the resources available. So we have a process where we partner with in-country groups and experts and systematically go through the NCCN guidelines and identify where modifications need to be made. This might be based on what clinical research looks like in that country or region. There might be metabolic differences. There might be differences in coverage and resource availability. So those are then incorporated into the guidelines, and we call these international adaptations of the guidelines. I want to emphasize this is a very bi-directional process. So often our guidelines will incorporate recommendations made by our international colleagues, and it really helps strengthen both of our cancer care systems and really emphasizes this learning across borders. We have programs in this area for Asia, Latin America, Europe, and the Middle East.
Very cool. That's great. So, what's your current perspective on the global oncology landscape, and how do you see the NCCN Global Program contributing to its development?
I think this is a very important and timely question. There's been so much progress made in terms of kind of prevention and access to treatment and management of infectious diseases over the last several decades. And this has really allowed the global health community to additionally focus on what's called non-communicable diseases, NCDs, like cancer, also cardiovascular disease, diabetes, rare chronic diseases. It's estimated that 67% of deaths in low and middle income countries are due to NCDs. So clearly an important disease burden to address. That being said, I think at the same time, the infectious disease agenda is unfinished. And there are current shifts happening in the global health landscape and funding, and countries will really have this dual burden of NCDs, but also trying to address infectious diseases like HIV. And this is going to be a huge barrier. But I think because of this, it's really critical as a global oncology community that we need to come together. We're part of a couple coalitions that I think really demonstrate this. We sit on the International Cancer Control Partnership, ICCP. This is a group of international organizations really dedicated to helping countries develop and implement what's called national cancer control plans. And we know from a policy level that the incorporation of national cancer control plans at the Ministry of Health level is really key to access to cancer care. We're also part of what's called the Union for International Cancer Control ATOM Coalition. So this is the Access to Oncology Medicine. This is focused on procurement strategies for therapeutics and diagnostics, and also capacity building. And at NCCN, we really believe that the guidelines can be used to act as a basis for capacity and a foundation to do needs assessment and quality measurement. From a policy perspective, this is also a really important year because the United Nations high-level meeting on NCDs and mental health is occurring in September. Member states are currently reviewing what's called a zero draft to then contribute to what will be called a political declaration in September. And there's a lot of work going on with member states and countries to make sure that their financial commitments for NCDs, and specifically that make sure that cancer is on that agenda.
Excellent.
Very good.
Brilliant.
And how can people access the NCCN global resources?
It's really easy. So
Great.
all the resources are available free of charge for non-commercial use. You simply need to go to our website, nccn.org. All you have to do is register, but it's all for free. We also have a mobile application that is available in both Apple and Android stores. For our global content, you can go to nccn.org/global. And we're also grateful that we have a collaboration with ONCOassist. And the ONCOassist team in their app includes resources from NCCN, including our chemotherapy order templates. And it really has shown easy usage and has really been able to distribute and utilize these tools, especially for international audiences. So thank you to your team. Yeah.
It's been a fantastic addition to ONCOassist, and we are already seeing the benefits to the users globally. So yeah, it's been great. So just moving on then, what are some of the challenges or barriers to cancer care globally that you see?
There's a lot, and I've mentioned some, in terms of disparities in outcomes and access in the current funding environment. I think some other barriers, there's been a lot of attention recently on what's called modifiable risk factors. So alcohol consumption, tobacco use, ultra-processed food, things like that, and the contributing, especially in younger people, higher incidences of cancer. There's also often a lack of screening programs, although I will say that WHO has really put a lot of effort into breast and cervical screening programs at the member state level. Unfortunately, in a lot of low and middle income countries, there's very late presentation of disease for various factors. But I think, again, this is an area as we build capacity, hopefully we can identify patients earlier in their disease prognosis. Geographic barriers. A country can have a really advanced cancer center, but it's mainly in the cities. And we know that a lot of people live in more rural areas, and getting to the treatment facilities can be really challenging. Medication access issues. So not only high costs, but poor supply chains and lack of availability. High out-of-pocket costs for a lot of patients, especially if the Ministry of Health is unable to provide access to a lot of chemotherapy drugs. Often workforce shortages, and this is not unique to low and middle income countries. I think we're all experiencing this, but significantly, I think in lower resource settings, they're increasingly burdened with seeing more and more patients. Data plays an important part because data registries really help guide your national cancer control plan and think about procurement strategies. So if you don't have the data infrastructure in place, it can be really hard to cost out what things are going to cost for your ministries of health and Ministry of Finance. I think there's still stigma and misinformation. And lastly, I think underrepresentation in clinical research is a huge issue. So we have all these great drugs, but have they been tested and tried on diverse patient populations, and what are the toxicities for some of those?
Very interesting. And just thinking about the future, what excites you most about the future of global cancer care?
So, I think there's a lot of exciting things, but I think the collaboration. So I want to highlight one of our longest global initiatives, and this is a collaboration we're really proud of. So this is with the African Cancer Coalition. So this is a group of oncologists on the ground in Sub-Saharan Africa, as well as the American Cancer Society and the Clinton Health Access Initiative. So we've worked closely with ACC and ACS to develop international adaptations of the guidelines for the Sub-Saharan African region. We've had over 300 oncologists in the region participate in the program, and 19 different countries. We have 56 of these guidelines, so 56 specifically adapted guidelines for the region. This covers about 95% of all incidences in Sub-Saharan Africa, and 7 ministries of health have endorsed these guidelines and are using them as templates to provide their national standards in oncology. We're also, as part of this initiative, seeing this kind of whole healthcare system approach. So the American Cancer Society has spent a lot of time and resources thinking about patient navigation, as well as HPV vaccination, and implementing the guidelines into practice. So I think something like this is really inspiring because it's multi-organizational, multi-nation approach that has really impacted cancer care on the continent.
Excellent.
And Katy, just as on a side note to that, like I suppose that would have taken quite a bit of effort in terms of bringing all those different countries and different, I suppose, clinicians together to be involved. Like, how long has that process been from start? Like, I suppose it might have started 10 years ago, maybe longer?
Yeah, so the discussion started in 2016 at the Aortic Conference. And I will say it took time, and we see this with all our initiatives. It takes time to build trust. And I think there was a lot of pushback in terms of having national guidelines versus a more regional effort. But what's been great about the initiative is we bring all these oncologists from different countries and cancer centers together once or twice a year. And they're really able to share either best practices or ask questions. It's almost like a multidisciplinary tumor board at times as we're going through the guidelines. And they learn a lot from each other. And then also, because they are 19 countries, they're kind of like a collective voice. And it really has been impactful in terms of advancing cancer care for the whole region, not just by country.
It must be fantastic to see those conversations going.
I love it. Yeah.
That's fantastic. And I suppose, what keeps you optimistic about the international oncology efforts?
So, not to just focus on our Africa initiative, but I think we have seen tangible results. So I just pulled these numbers for a presentation the other day. So our registered users, it's a good gauge on kind of capacity. So in 2017, when we started discussions about our work in Sub-Saharan Africa, there were 4,000 registered users. Today, we have over 15,000 registered users. So they have really invested in the workforce, which plays a key part in kind of building an access to cancer care. We also recently submitted an abstract to the Aortic Conference where we looked at the breast cancer adapted guideline from 2017 and compared it over time to the 2024 version to see what has actually changed and have they built capacity. And actually, there are many things that are now available or accessible that weren't available in 2017. So that includes imaging techniques, biomarker testing, different treatment options, immunotherapy. So we can see kind of the step-by-step approach they've taken to build capacity. Another area that I think has, especially in the last couple years, is this idea of building capacity for research, and it really trying to invest in research initiatives on the ground in places like Sub-Saharan Africa, but also Latin America, Eastern Europe, areas like this. So these are what I'm optimistic about, kind of the change and the tangible things we've seen over the last couple years.
Would you have any concerns?
I mean, I think I alluded to this earlier. I think the my biggest concern today is kind of this overall shift in the global health landscape and funding mechanisms, and how that might downstream affect NCDs. I think the most immediate effect will be infectious disease, because that's where most of the global financing goes. But I think if governments have to shift towards just the immediate infectious disease burden, then NCDs, cancer might be put on the back burner.
Makes sense, yeah.
But I will say NCCN is committed to continuing to address the global cancer burden, and I'm hopeful that there's enough groups and collective and collaborative work that we can continue to push this agenda in the global oncology space.
Great. And, you must have learned a lot from working with government, NGOs, clinicians and payers. Any advice or any insights?
Yeah, I mean, we know cancer is complex and the pace of innovation is significant. So I think it takes all of these different stakeholders to have a seat at the table and to really make sure that cancer care is on the agenda for countries and ministries of health. We do believe guidelines can really provide this wonderful basis and foundation to think about ways to build capacity and measure quality at the physician level, but also at the policy level and private payer level and private entity level. So I think we're seeing examples of this, and I hope, moving forward, we can continue to see more areas where we're all coming together to have that collective voice.
Very good. And what role do you see in AI playing in the future of oncology, and particularly with practice guidelines as well?
I don't know about you guys, but I feel like AI is everywhere now. Every news article says AI, every conference. And I want to say by no means am I an AI expert, but I do think it's a very exciting time to see how AI is being incorporated into healthcare in really innovative ways. NCCN, at the start of our initiative in Africa, IBM was part of that coalition, and IBM Watson. And I think, and we know now, it was a little too early for that. I think things have changed, and we're really kind of on the frontier lines of seeing what AI can do for cancer care. I do hope that people are thinking about how do you balance AI's promise without sacrificing reliability and the quality of the clinical data. And I think a lot of people are thinking about this. I will say along the same lines, a few weeks ago, NCCN launched what we're calling the NCCN Guidelines Navigator. So this takes our PDF NCCN Guidelines, incorporates it into more of a virtual tool, and it hopefully makes is able to provide users with more searchability and navigate the guidelines more easily. And our future plans include the incorporation of AI to make search more conversational and intuitive. And hopefully that tool also incorporates our global content down the road.
Great.
And final question, what advice would you share with oncology professionals aiming to move from clinical roles into policy or global health leadership?
I often say you can have the best therapies in the world and you can have the highest quality, most up-to-date guidelines, but if policies and healthcare system capacity cannot support the delivery of these recommendations and therapies, then patients will never receive access to these high quality, innovative treatments. And so policy and advocacy plays such a key role in access. And I think there's a lot of work that can be done in terms of education of policymakers and funders regarding the importance of cancer. There is a moral argument, but there's also this very important economic argument because of the disease burden, disability burden of disease like cancer. And so clinicians can really provide a key voice in these discussions. So I would encourage your listeners who want to get more involved into this space, really engage directly with your ministries of health or other policymakers, because your voice is definitely needed in these discussions.
Excellent. Brilliant. Thank you very much, Katy. Thanks very much for your time. Really appreciate it.
Thank you. It was really exciting, and hopefully we can continue to work together to really advance cancer care globally.
Brilliant.
Thanks, Katy. Likewise, yeah.
Katy, that was a really insightful conversation. Thanks to you for sharing your valuable thoughts and insights with us. I am certain our audience found it as enjoyable as we did.
And thank you to everyone for joining us and listening to the podcast. We'll see you on the next one. Cheers.
Cheers.